Okay, hi and good morning to my fellow doctors, physiotherapy, pharmacists, and nurses. So today we're gonna discuss about patient Mr. Zaki, 34 years old, executive officer, was admitted to the orthopedic ward with a complaint of chronic ulcer on the left foot. He experienced this problem after the use of new sport shoes over the past week. He was also diagnosed with diabetes mellitus for the past 10 years.
Doctor, could you please explain what is meant by a chronic ulcer?
Thank you, Ms. Hani. A chronic ulcer is a wound, usually on the leg or foot, that doesn't heal properly over time. It is not caused by an injury, but by health issues like poor circulation or diabetes. These open sores can get infected easily and require medical help, often taking months to fully heal.
So, Ms. Akila, in your experience at the ward, how can inappropriate footwear contribute to the development of ulcers in diabetic patients?
Thank you, Ms. Nurul, for your question. First of all, the main point that we get is tight shoes. Can cause excessive pressure on toes, heels, or sides of the feet. The next is high heels. Can increase the risk of pressure and friction, especially on the toes. And the last one is shoes without cushioning. It can absorb pressure when walking.
May I interrupt you? Can I add some of my point? Okay, the first one is shoes made of hard and or rough inner material. It can cause friction and small cuts. Next, loose fitting shoes. Feet may slide or rub inside the shoe. The last one is open toe or open footwear, example sandal. It is high risk of injury of sharp object. Okay, Miss Nurul, can I ask you a question? What type of footwear would you typically recommend for patients with diabetic foot ulcer?
For those who have diabetes must wear lightweight shoes with a stable sole and a wide front area. And then the shoes must be also free of the anti-slip, tied to avoid slipping easily. That's all. So, next question. Could you describe how the underlying pathophysiology of diabetes mellitus leads to the development of chronic ulcer?
Thank you for the question. So, the pathophysiology of diabetes mellitus is, the first is atherosclerosis and diabetic peripheral neuropathy are two main causes leading to a complication of diabetes such as ulcer. Atherosclerosis leads to decreased blood flow in large and medium-sized vessels, secondary to thickening of capillary basement membrane, loss of elasticity, and deposition of lipids within walls. Further atherosclerosis leads to a small vessel ischemia. Peripheral neuropathy affects the sensory, motor, and autonomic nervous system. There are multifactorial causes such as vascular disease occluding the vasa pneumorum, endothelial dysfunction, chronic hyperosmolarity, and effects of increased omicron and fructose. So, Ms. Atila, can you list the three main nursing problems for Mr. Zaki? Thank you, Doctor. So far, I get the three main nursing problems for Mr. Zaki, which is impaired tissue integrity related to foot circulation, infective peripheral tissue profusion related to foot ulcer, and the last one is risk for infection related to compromised immune system. Based on Mr. Zaki's presentation, what medical diagnosis would you consider in relation to possible wound or joint infection, Dr. Zakwan?
Okay, thank you, Ms. Virus. For my opinion, the diagnosis may I create with Mr. Zaki is first is acute pain related to inflammatory process of infections. Second, impaired physical mobility related to joint disruptions. Three, risk of infection related to open wound. Next, hypothermia related to systemic infection. And then lastly is fatigue related to inflammatory response. So, Ms. Bumo, what antibiotics are suitable for the patient that will have in the healing of diabetic wound?
Thank you, Dr. Sakwan. So, I will this type of antibiotics that are suitable for patient to healing of the wound. First, I suggest vancomycin. It's peripherally as an empiric therapy due to its narrow spectrum, which covers aerobic gram-positive organisms. Physicians should use vancomycin empirically in conjunction with other agents such as ceftazidime. Second, ampicillin. It effective against many bacteria, including those commonly found in diabetic foot infection. Next, piperacillin or tazobactam has a broader spectrum of activity and is often used for more severe infection, including those with Pseudomonas aeruginosa. Uh, Next, we have ciprofloxacin and clindamycin. This combination is used when a broad spectrum of coverage is needed. Last, I suggest linezolid, specifically indicated for diabetic infection and is effective against MRSA and other gram-positive bacteria. Um, I want to ask to the doctors, can you guys explain to us about what you guys understand about the sequestrum and how it can occur and its complication?
Okay, thank you, Ms. Hani. A sequestrum is a piece of necrotic bone that has become separate from healthy bone during the process of osteomyelitis, bone infection. It appears as abnormal shadow on X-ray or imaging due to its distinct density or non-variability.
So, next, spectrum occur by the infection such as a diabetic foot ulcer spread to the bone. In fact, typically inflammation cause increased pressure in the bone. The pressure compromise blood supply, especially in diabetes with pure circulation, then of lack of blood supply lead to the bone necrosis, and necrotic become isolated from the healthy bone, forming a spectrum.
So, the complication of sequestrum is chronic osteomyelitis, non-bleeding wounds, spread of infection, and may lead to amputation. So, Ms. Asha, in your opinion, why ulcers on Mrs. Zaki's weight can be cured by antibiotic and dressing?
Thank you for your question, Doctor. In my opinion, why ulcer on Mr. Zaki's leg can be cured with antibiotic and dressing is because impaired blood flow and oxygen delivery. Diabetes often leads to peripheral vascular disease, which reduces blood flow to the feet and legs. This impacts circulation, hinders the delivery of oxygen and nutrients essential for wound healing, and also limits the effectiveness of antibiotic in reaching the infected tissue. The second one is compromised immune system. Diabetes can weaken the immune system, making it harder for the body to fight off infections. High blood sugar level can also impair neutrophil function, which are crucial for fighting off bacteria. Number 3, biofilms. In chronic wounds, bacteria can form biofilm, which are communities of microorganisms embedded in a protective matrix. Biofilm make it difficult for antibiotics and the immune system to penetrate and kill the bacteria, hindering healing.
Oh yeah. Doctor, may I add some opinion?
Yes,
Which is comorbidities lead to other health conditions such as kidney disease or cardiovascular disease and further complicate wound healing and infection control in the patients. So the next is inadequate offloading. Pressure from shoes and walking can exacerbate ulcer and make them more difficult to heal. Proper offloading techniques such as using special shoes or spins are crucial for promoting healing. So the last one is uncontrolled hypoglycemia. Poorly controlled blood sugar levels can impair wound healing and increase the risk of infection.
Okay, Miss Umar, can I ask the question?
Oh, sure.
How would debridement would help the patient?
Okay. Wound debridement will help patient to promote the growth of the tissue, reduce inflammation in the wound bed, and improve the effectiveness of topical treatments, thereby reducing the risk of infection and allowing for better wound healing. After surgery, the patient's wounds still show no improvement, and finally the patient was planned for below knee amputation. Okay, at first, the patient did not accept the amputation and wanted to this. Lepas tu, aku jaga bukan. Jaga bukan. Okay, aku macam tu. Aku tanya kawan. Dr. Maris, may I ask you a question?
Yes.
Is amputation the best treatment option for this patient?
Okay, I think the patient need to amputate because amputation is the best treatment option in these cases. The patient won't show no improvement post surgery, indicating possible severe infection through vascular supply or tissue necrosis that is unresponsive to conservative treatment. When limb surface is no longer visible and the limb is first at the risk to the patient overall health, below knee amputation (PKA) become a necessary intervention to prevent further complications like sepsis and to improve the patient quality of life.
Thank you, Dr.
So, Dr. Bell,
Yes.
what is a specific investigation before amputation is performed?
So, in my opinion, there are three specific investigations before amputation. Okay, the investigation is number one, we have blood ultrasound or ankle breaking index (ABI) to assess peripheral blood flow and vascular status. Number two, X-ray or MRI of the affected limb to evaluate the extent of bone and soft tissue involvement. For example, osteomyelitis. The last one is common investigation, blood tests. For example, corporate blood count, CRP, ESR, blood glucose level. To assess the patient markers and underlying conditions like diabetes or anything. So, Ms. Rashra, can I ask you a question? In your opinion, why did the patient not agree to the surgery in the first place?
Okay, thank you for your question, Doctor. In my opinion, he should not agree to the surgery in the first place because he is fear of amputation. When patient feel anxiety about losing a limb, fear about the pain and long-term consequences. Number two, emotional instability or not mentally prepared. The news of possibly losing a leg can cause emotional disturbance and stress. Number three, lack of understanding about the risk of not undergoing surgery. Patient that might not be aware of serious complications such as spreading of infection or the risk of sepsis. Number four, hope for recovery without surgery. Some patients may be hope that medication or wound care will be enough without needing amputation. The last one is concern about self-image physical ability post-surgery. Worry about disability, inability to work.
Okay, before Rose, what is your nursing intervention for anxiety related to amputation? The patient is successfully undergone the surgery and was start with activities. Please suggest the nursing intervention for this patient.
Okay. So far, I get the intervention is assess the patient level of anxiety using a scale, such as using the memory rating scale 0 to 10 to quantify anxiety health rate changes and evaluate intervention effectiveness. The second one is encourage the patient to verbalize stuff and feelings about the amputation, to express of emotion, reduce internet tension, and foster emotional healing. So the third is provide factual information about the surgical procedure, recovery expectations, and prosthetic options. To education helps them simplify the process and reduce fear of the unknown. So the fourth is reinforce positive coping strategies the patient has used in the past. Patient to building on existing strengths boost confidence and adaptive behavior. The fifth one, demonstrate and teach relaxation techniques such as deep breathing, progressive muscle relaxation, or guide imaginary. These methods reduce physical symptoms of anxiety and promote a sense of control. Number six is involve the patient in decision making regarding their care and rehabilitation goals. Autonomy in care foster involvement and reduce feelings of helplessness. The second one is facilitate peer supports by arranging contact with other individuals who have undergone education. Passionate to peer experience can normalize the patient's emotions and offer hope. Number eight, provide consistent emotional support through active listening and therapeutic communication. The consistent support builds trust and allows the patient to feel understood and valued. The second last is encourage patient involvement and provide education to the family about how to support the patient. Patient to family supports can improve emotional outcomes and strengthens the patient's social networks. And the last one is refer to psychologist, counselor, or social worker as appropriate. Mental health professionals can offer deeper psychological supports and therapy for grief, trauma, and persistent anxiety. So, Miss Ada, can you explain about the amputee rehabilitation?
So, rehabilitation after an amputation is to help the patient return to the highest level of function and independence possible while improving the overall quality of life, like physically, emotionally, and socially. In order to help reach this goal, amputation rehabilitation programs may include the following. So first, treatments to help improve wound healing and stomach care. Activity to help improve motor skill,
install activities of daily living, ADLs, and help the patient reach maximum independence. And then exercise that normal muscle, strength, endurance, and control. Feeding and use of artificial limbs. Next, pain management for both post-operative and therapy. Next, emotional support to help during the grieving period and with the adjustment to a new body image, and then use assistive device. And then next, last one, patient and family education. So, the next question. Oh, no. Yeah, this one. What complications should clinicians, what complication nurses be aware of following? What nurse?
Baca je soalan.
Okay. Baca dah kata yang baca je dekat yang ni bukan baca kat WhatsApp, baca dekat yang paper. Pertama ni ayat dia baca dah.
Okay.
Okay, explain.
So list the possible complication of that Mr. Zaki may experience after PKA. During follow-up, the doctor informed that patient that issues samples taken during amputation surgery showed stage 2 malignant tumor in the distal tibial section. So, doctor? So, Miss Hadi, list the possible complication that Mr. Zaki may experience after PKA. During follow-up, the doctor informed the patient that tissue samples taken during amputation surgery show stage 2 malignant tumor in the distal tibial section. Can you give immediate or post-operative complication?
Thank you, Ms. Hada. So I'll give as much as I know about the immediate or post-operative complication for this patient. So this patient might get an infection at the surgical site or deeper, for example, osteomyelitis. Second, he may get hemorrhage or hematoma due to blood vessel damage or poor clotting. Third, delayed wound healing, especially common in patients with diabetes, poor circulation, and malnutrition. And then, this patient might get deep vein thrombosis or pulmonary embolism because resulting from immobility and altered circulation. Next, phantom limb, pain or sensation. This patient may feel pain or pieces of the amputated limb, lungs contractures, particularly in the knee or hip if proper positioning and exercise are maintained for this patient. Dr. Bell, can you give me some more about this immediate or post-operative complication?
There are several intermediate and recovery fascination. There are some swelling or edema that can lengthen and possibly skin breakdown or pressure sores, especially if the stomach is not well protected or if using a prosthetic improperly. The next is neuroma formation. Painful nerve ending at the stomach site that may require treatment. Emotional and psychological impact. Depression, anxiety, and mood image disturbance are common and important to address. So, Faris, can you give us a long-term complication?
Sure, Doctor. Well, first difficulty with prosthetic use. First, downshift, pain or improper fitting may affect mobility. Second is dry equivalent of the pain. Due to an even weight restriction or improper prosthetic use. Third is chronic pain, ongoing stomach pain, phantom pain, or pain due to prosthetic use. Next is an increased risk for further amputation, especially if the underlying condition, diabetes or PAD, is not well managed. And the last one is social and vocational challenges, include reduced independent exertion or job limits. So, Dr. Riza, can you explain about the chronic ulcer disease with the causes of tumor occurrence? And what is the next investigation for Mr. Zaki to identify the spread of cancer cell to other organs of the body?
Okay, thank you, Dr. Zafran. Chronic ulcer disease can be cause of tumor occurrence. This is well documented phenomenon. Chronic ulcer, especially non-healing, long-standing wounds such as in diabetic foot ulcer, can undergo malignant transformation over time. This condition is known as margarine ulcer. This is classic example of squamous cell carcinoma arising in chronic wounds, burns, or long-standing ulcer. It typically occurs after years of chronic irritation, and while it most often involves the skin, deeper tissue including bone can be affected and severe cases. The next investigation would be imaging studies such as whole body PET CT scan or MRI. PET CT okay?
That's what it.
The next.
So the next.
So the next investigation would be imaging studies such as whole body PET CT scan or MRI, which are commonly used to detect metastasis and assess if cancer has spread to other organs.
So the patient will be treated after this.
Yes. So that's all from our discussion for this patient, Mr. Zaki. Thank you.
So Mr. Zaki will be here.
Yeah, so
Yeah.
so that.
So,
Yes.
yeah.
So anything that they can just update
Yes.
to us.
So we will be collaborate with pharmacy
The physiotherapy and the
and
nurses.
nurses. Thank you so much.
Thank you.